Good evening. This is Violette Haldane, and today is Monday, December 14th, and this is another one of our Coalition Community Conversations. This evening's topic, we will be focusing on health, and our facilitator and presenter is Dr. Gary Rhule. Dr. Gary Rhule is an emergency room physician and former director of public health for the city of Hartford. And we're so pleased to have you here today, Dr. Rhule. So I'm going to turn it over to you as we continue our conversation on COVID. Thank you.
Okay, thank you, Violette, and welcome. I'm going to share my screen. Can you see that?
Not yet.
Everyone can see?
You're muted.
I'm muted? Okay, so
No,
1 second.
Miss Haldane, you're muted.
I just gave you the ability to share, Dr. Rhule, so can you try again?
Okay, let's see. I'll share my screen. Okay, you should be able to see it, right? But can
Yes,
you still hear me?
we see it.
Can you hear me though?
Yes.
Okay, perfect. Okay. Well, welcome to tonight's topic. I'm Dr. Gary Rhule, and tonight we're going to be talking about COVID and your mental health. I think that's what we signed up for. So I want it to be really interactive. This is part of our health literacy series, and this is the second one. That's COVID, as you've probably seen many EM, electromicrograms, graphs of this. That's what it kind of looks like with all the spike proteins. Today, we're going to talk specifically about isolation, domestic violence or intimate partner violence, stress, anxiety, and depression. And then we'll open it up for a Q&A at the very end. And then, of course, where can I get more information? The first slide you should be seeing, I just gave you an idea of the prevalence of COVID infections across the globe. As you can see, 72 million persons are infected. We've had about 1.6 million deaths, that's across the globe. In the US, 16 million persons, and the deaths really is top 300,000. Locally in Connecticut, 146. And deaths, this was as of last Thursday, 5,368. So it's a lot of people, obviously. In Hartford County, about 1,600 persons have died from COVID infection. Of course, we kind of know what COVID is. We talked about this the last time. So it's a SARS, it's a coronavirus, and it causes COVID-19. All right, tonight is about what is mental health. People, I think, kind of interchange the idea of mental health, behavioral health. Pretty much, I just wanted us to be on the same page about what mental health is and what it's not. It's a state of well-being. It's how your mood, your emotions, your thoughts, and your personality affects how you cope with everything that life brings. And as all of us know, life brings us many things: joy, pain, grief, loss, major milestones, weddings, births, deaths, etc. And so mental health is how all of those things, our mood, emotions, our thoughts, and our personality helps us to maneuver through everything that life basically throws at us. And I want to just make it clear. So tonight we're talking about mental health broadly. We're not really, and I'll talk a little bit about mental health diagnoses, right? If you talk about a diagnosis, realize that that is you go to a healthcare professional. They would make the diagnosis. You can't sit back in your living room and watch your uncle who sits on the sofa for 6 months and you figure out that he has schizophrenia, depression, or whatever. That diagnosis is made by a healthcare professional. There are obviously risk factors, whether it's from the family history, personal history, certain traumas that we've experienced. And COVID obviously is a trauma, right? It's not a mental, it's a mental health / physical health diagnosis. If we say eventually that somebody has anxiety, depression, these are medical diagnoses, right? Which are different from saying somebody has stress or isolation. Those aren't medical diagnoses. Those are just talking about experiences that people are going through. If you do have a mental health diagnosis, it's not a personal weakness. It's not a moral weakness. It's not because you're possessed by the devil or the demons. It's none of that. It's not spiritual weakness. So just kind of ground setting about when we eventually talk about the mental health diagnosis, just to understand that there's a biological basis for it in the brain and there are risk factors that people have. So just kind of make sure that we're talking from the same dictionary, basically. All right. Why are we talking about COVID-19? Since this virus became known early January of 2020, what it's really done, it's a trauma, right? So what is a trauma? A trauma is any unexpected, or it could be expected, loss or change that we experience in our life. And it's traumatic because it's a sudden change, it's unexpected, and a lot of us are worrying for many, many reasons that I'll go in a little bit further on. So we're talking about it because we know that the experiences that we're having collectively, as well as individually, has resulted in fear, worry, and a lot of stress. Obviously, fear, worry, and stress are normal responses to threats that happen in our environment, whether they're real or they're perceived. Specifically for COVID-19, it's a trauma because it's sudden, it's changed our lives, there's a lot of uncertainty about what's going to happen. The virus is new, we're still learning, so every single day when you wake up, they're throwing something new at you about what it is and what it's not, and what you should be doing. There's also the fear of becoming infected because many persons, it's 9 months into the infection, and the numbers I just showed you, right? So a lot of persons in Connecticut have died, have become sick from it, and we are fearful that, obviously we don't want to become infected because we don't know how it's going to affect us, affects our family, affects our friends, and the people that we love. So fear, worry, and stress, those are all normal things with what's happening with this new virus that we're still learning about. This is kind of just recapping what I said before, right? So because many people have become sick, we know that in the last year, persons are complaining more of their mental health being taxed, being fearful, being worrisome, the uncertainty of it. And we've had many friends and families and colleagues who become sick. That just means morbidity, and or they've passed away. And what we've also found, though, if you previously had a health condition, if you previously had a mental health condition, whether that's anxiety or depression, from April of this year to June, many reputable organizations have reported that these disorders have increased compared to 2019. And we wouldn't be surprised because, again, COVID-19, in my definition, is a trauma, it's a change, it's unexpected, and it's disrupted really everything in our lives. The other thing that has really been disrupted is, of course, you have these stay-at-home orders, right? So workplaces have shut down. If you had any mental health condition where you were seeing a healthcare provider, well, these services have been disrupted, right? So you can't necessarily walk in to see your therapist, your doctor. There are all these little steps that you have to do to get there. And if you're looking specifically at mental health services, that's compounded by the fact that even on a good day, mental health services were vastly underfunded, not enough providers, not enough beds, a long wait time to see your therapist, a long wait time to see the psychiatrist, and especially for the youth population or for the older population, those services were really running on a shoestring anyway. And so now you basically throw this trauma in there, and it's caused a lot of this disruption. Some of the ways in which we've tried to fill that gap has been through telemedicine. So you might find that your doctor or your therapist is calling you on the phone. If you have video capability, you can talk to them that way. There's obviously telepsychiatry and teletherapy that you can do. Part of the problem, though, is for a lot of us, and especially for our seniors and elderly, if they are not engaged with FaceTime, Zoom, or any other video platform, that limits your access to the provider. Because really you're used to calling the provider and or them calling you, and you're going into the office and you're doing your follow-up and you're doing your therapy that way, whatever that therapy might be. So the people at risk really tonight, we want to talk about the elderly persons, especially because we know they may not be comfortable with the technology. They don't use it all the time. And you don't have people reaching out to them constantly to make sure that they're engaged with that. They may also not have Wi-Fi at home. They may not have a laptop at home. And you probably can do it a little bit through your telephone, but again, you have to be facile with getting access that way. And even on your telephone, that's a bit hard. So the biggest barrier for a lot of us, especially in the West Indian community, is it's kind of compounded by the fact that we're not connected. Well, but even before that, right, the services are running on a shoestring. You're not connected. Your phone will kind of do it, but the Wi-Fi is not always constant, and that's not the place to do that. So you end up being isolated and cut off from the services available to you. So we'll talk about that hopefully when we have that talking session at the very end. Of course, as you know, COVID has done a lot of stuff, and the public health measures that we definitely need to make, we know that makes a difference in people's lives, are social distancing, physical distancing. There's stay-at-home orders, not to go outside, not to leave your home unless you really have to. Of course, you have to go to do the specific things. Getting food, maybe you could have it ordered in. Your prescriptions, maybe you could probably have that ordered in if there's home order. So you've had that stay-at-home orders unless you really have to. Then you have the physical distancing, especially for elderly persons, because if you're a young person going out and you're in the community, you don't want to bring that infection into the home, to your parent, to your grandparent, somebody who has a chronic medical condition. So a lot of folks are kind of doing this drive-by, and it's 9 months into the infection, and that's a problem. Above and beyond that too is if somebody becomes sick and they're in the hospital, you can't go in. If your loved one becomes sick and they're in the ICU, you're not allowed to go in to see them, right? So you're seeing them through a FaceTime that somebody else is kind of doing. And that obviously has a lot of emotional stressors on us. You're working from home. So typically if you're interacting with your friends, your colleagues, your family, you're basically at home doing all of that. A lot of places of employment have closed down, so you're unemployed. Again, you're cut off from the usual social, recreational, spiritual things that you've been doing. That's traumatic. That's what a trauma is, a loss of something that you're used to doing. You're also homeschooling children. That's a definite change, right? And again, just a lack of communication, physical contact with your loved ones, with your support system, that's traumatic. And this is what trauma is, a sudden change in your life that is completely unexpected. In terms of the things that we're seeing, of course, because of the impact on the healthcare system, persons are going through bereavement, isolation, there's loss of income, you have fear, many fears. And then especially as we said before, if you've had a known mental health condition, this is really making it a lot worse. One thing I also want to point out that we've realized both in Connecticut and across the globe, right? So some ways that people have been dealing with the stress is increasing their use of alcohol or drug use, in thinking that that will help them through it. The number of persons, did you have a question? I heard a talking. No? Okay. The number of persons abusing drugs and the number of drug overdoses have actually also increased during this time. Fear and stress and anxiety results in many, many things. Overeating, undereating, problems with sleep, insomnia, oversleeping, and just increased stress, anxiety, and depression. I'm going to stop for a second to see if anybody has any question. I didn't see in the chat if anybody has any questions at all. And if not, I'll just keep on going.
No questions.
All right. So apart from the indirect or really direct impact that COVID-19 and the pandemic has had on us, the disease itself, the virus itself, also has some neurological and mental health complications. Persons have had stroke, and we can talk about that later, why that's happening, right? So stroke can resulting, obviously, changes in your behavior, thinking, your acting, being able to move your arms and your leg, and also a mental health complication of COVID-19 from the virus infection. People becoming delirious, delirium meaning they're not aware of their surroundings and where they are, and just agitation. So those are the direct complications from the virus itself. All right, just another nice picture. Okay, I kind of wanted to just stop for a second, because when we talk a lot about stress, and stress is not a mental health diagnosis. Stress is a condition, right? So it's a condition of feeling emotional or physical tension, and it can come from any event, any thought that disrupts your daily life, about everything I just talked about, right? From your waking, sleeping, eating, working, worshiping, schooling, anything, any event, any thought that disrupts your usual way of life can be stressful. And some of the things that people describe with stress are anger, nervousness, frustration, agitation, pacing, etc. And of course, then your body reacts. You kind of have these reactions where you're tense, your heart is racing, you might sweat, you feel nervous, all of those things. That's what stress is. Now, some stress is acute, like example, you have a really difficult job interview or an exam, and you kind of go through that stress, and once that's over, once you've kind of dealt with that, the stress goes away. But a lot of us are living on a chronic stress pre-COVID because of many things that we face in our community, like lack of access to jobs, employment, family support, compounded now by the pandemic, and it really just compounds the things that we're feeling. And we've felt this for a long way. And chronic stress then can actually lead to other things. That's why I kind of just wanted to point this out. But stress is not a mental health diagnosis. It's just a condition and a reaction to things that's happening in our lives. So how can you cope with stress? Obviously dealing with the thing that you think is the event that's causing it. And then just some things that we know that with acute stress will help us get through the day typically. And there are many, many things. I just kind of threw some things up here. Physical is spelled wrong, but it's physical activity, exercise, talking to your support system, your family, your friends. I journal, I write things down. It just helps you to get a perspective on what's going on. Laughter, comedy, going to the West Indian Club, dancing when you could, going online and doing your Zoom dance or whatever you can do with your Zoom, the Zoom class, Zoom yoga, anything that really, makes you feel energized and recharged, and you can basically face the next day. Sometimes we get a lot of stress because we take in a lot of commitments. So one of the ways to cope with it is learning to say no, having barriers, saying no when it's appropriate, managing your time. If it's about your exams or your work, being sure that you manage your time appropriately and you're not overcommitting yourself. These are just kind of some examples that I think you already know about. Mindfulness is a technique that we can talk about later on in the Q&A section. And many, many persons like us in the African American, West Indian, Afro-Caribbean diaspora, we believe in our faith systems. That's where we get our source of support from. And now that we're physically distanced, you can do that hopefully by a phone, by Zoom, by FaceTime. You can still engage with your faith community by seeing the service and keeping grounded that way. So just a couple of examples. I threw supplements in because I know a lot of us from Jamaica and the Caribbean, we use things like chamomile, busy, roots wine, whatever you think that's going to help you gain back your self-centeredness and your core happiness. Do the things that you think are going to help you do that. And there are many, many things, obviously, that can help you through that. So that's stress. Well, I wanted to take the time specifically to talk about the elderly, though, because of social distancing and the isolation, both inside of your home, the lack of recreation. If you were used to going to, for example, the North End Senior Center because you could see your friends, you could play your dominoes, you could go to the West Indian Social Club, you could dance with them, you can commune with them, you could eat with them. Well, that's not going to happen based on the stay-at-home orders and the social distancing. And the truth is, it's 9 months. You're going to be isolated. You're going to feel like you're not connected. And the truth of the matter is technology can't replace that physical need that we have. So our elders definitely are at risk because they may not have adapted to the technology use, but even if they did, it's still disruptive for them. I know like some of the families, they'll drive by and they'll wave to the loved one. That still doesn't take the place of actually sitting in front of somebody, communing with them and eating and playing your dominoes. It's just not the same. So isolation, again, is not a mental health diagnosis. It just is a way that increases person's risk because you're isolated, you're not communicating with people. And actually, really, we know that even for things like dementia, social isolation and not talking to people is a risk factor because you're really not using your brain, right? So that's definitely a risk for our elderly population, seniors, elderly, but really for all of us. So how do you cope with it? We kind of touched on that before. You could do the phone call. It's still not the same. You could do the video call, FaceTime, Zoom call. It really isn't the same anyway. And again, as I said, engage in the faith-based program virtually. You should do that if you can. You can do the drive-by and keep the physical distances like we do if you have someone's birthday. You can't really go up to their porch, but you can still have them, call them, tell them, look out the window, go onto the porch, drive by, talk from a distance, and still make them know that you're around. For your loved ones in a nursing home, that kind of happens the same way, right? The staff may put them by a window, they can see, you can talk, you can wave, you can do your party outside, they can still be connected that way. It still doesn't really take the place of that physical, that closeness that you need, but it's at least something that we can do. And the one action step I would say for us would be, if you know your neighbors live by themselves, your friends are by themselves, to do the outreach to them directly, especially when you know that they're alone, to offer to do their shopping, whatever you know they might need, and you can ask them so that they still remain connected. Well, this is really important for a lot of our West Indian persons, Jamaican people. They're home by themselves in their home. The family might not be around, and so we should actually do that action step to outreach to them to be sure they're okay. We're going to make a rapid switch to another thing that we're seeing happening. So domestic violence and intimate partner violence, basically by definition, is a pattern of abusive behavior in any relationship that's used by one partner to gain or maintain control over another intimate partner. Before COVID, it was affecting 1 in 4 women and 1 in 10 men experience this intimate partner violence. And the violence can take various forms, right? I'm going to show it a little bit later on. But because of COVID, what really is happening with, again, you have the social isolation, you're not going out to work, you're not going out to school. So the rates of intimate partner violence and domestic violence has actually increased since the pandemic started, because the victims are actually trapped, and I'll use that word, they're trapped in close quarters with their perpetrators. So when it was pre-existing before, those rates have increased. And we're seeing new cases as well for that very same reasons. The potential risk factors are many, we can talk about that. But again, isolation, the perpetrator, substance use, substance abuse, people losing their job, loss of income, a lot of financial stressors, inadequate support systems. They might have existed prior because you could actually leave your home and get to them on the outside. Now you're physically trapped with the abuser. One of the things I want to just point out to you, though, that shelters are still open, and there are ways that you can still reach out to them to get the help that you need. And always, there is always the emergency as you need, 911. I'll give you some other numbers at the very end of this to let you know that help is still available. But those rates have definitely increased across Connecticut, across your own community, and across the globe, and it's problematic. The types of abuse that you are very familiar with obviously are physical, sexual, emotional, economic, psychological, threats, stalking, cyber stalking. All those things have gone through the roof since the pandemic has started. So it's what we call a pandemic instead of a pandemic. And unfortunately, we're not talking enough about it. So that's why I'm bringing this to your attention, that this is happening. And persons are trapped and help is available. And I'll give you a couple of numbers and ways that you can actually get the help. So some of the resources, I can leave that in the chat line for later on. A crisis line, you would text home to 741-741. If you're a parent, 1-855-427-2736. There's a child helpline, 1-800-422-4453. For the National Domestic Violence Hotline, you could text LOVE IS, so LOVEIS, to the number 22522, or call 1-800-799-7233. Don't memorize these things. The easiest way to actually get help, what I recommend to folks is 211 in Connecticut is really the hotline for information. So the number, if you forget all of these, are to call 211 in Connecticut, or in Hartford, 311. They can actually kind of get you to that as well. But certainly to use that text numbers I'm just talking about. If you wanted to find about, again, another source, Futures Without Violence, there's a website that you can go to, Futures Without Violence, FUTURES, withoutviolence.org, and there's a resource tab that you can go into. For those who don't have the internet, two numbers really you need to remember, 911 and 311. That's what I would just do. All right, we're going to make another quick switch into, we talked about isolation. We talked about the fact that intimate partner violence has increased, and that's really a horrible thing, a pandemic within the pandemic. That's why my thought is I'm so glad a vaccine is here so we can at least address the medical piece and get folks to be able to leave their home to get the care that they need. The next couple of topics I'm going to talk about are anxiety and depression. So what is anxiety? Anxiety is fear and worry that results in disruption of the things that you do. Every one of us experience anxiety. It becomes a medical / psychiatric behavioral health problem when it affects everything that you do. So you can't work, you can't go to school, you can't worship, and it basically interrupts your everyday life. Then it becomes what would be called a mental health illness. But everybody basically has anxiety, and the problem is how it disrupts your life, where it becomes a problem, then it becomes a mental health illness / disorder. This is for teens, but it basically says when a survey was done by teens between 13 to 17, over 70% of them said anxiety and depression was a concern for them. So it's significant and disrupts their function both daily and a chronic basis. Some of the symptoms that you may be familiar with: recurring fears and worries about routine parts of the stuff that you do every day, getting up, waking, eating, feeding, everything that you would typically do. And some of the things that you would recognize would be changes in your behavior. You're just constantly irritable. You know, you avoid activities that previously you would like to do. You don't want to go to school. You want to interact with anyone. Last Saturday, I kind of was feeling the same thing, and I laid in bed for like 10 hours. Typically, I didn't do that. But the next day, I got up and I was able to do my function, right? So if it happens one day and it passes, that's okay. The problem is if it becomes a chronic problem where it prevents you from doing the things that you normally would do. If you're not in school, I would look at the things you would typically do: working, worshiping, engaging with the community. If you're avoiding those things, for school-age children, it's really more about the things that they would be doing: school grades. But for all of us, we obviously sleep, we eat, we concentrate. So any behavior like that would be a sign of anxiety. And what can you do to help? Having a conversation like we're doing now is helpful, so you understand what those mean. Talking to somebody that you trust and love, whomever they might be, about the things that are stressing you and you believe that are causing you anxiety, before it becomes a problem where it's affecting everything that you're doing in life. A lot of us, I know, on the West Indian folks, we have a high expectations, especially for our kids, in terms of performing in school, and we have high expectations for ourselves. And sometimes those expectations, they actually become stressors and become chronic stress for us, because some of the expectations are really high. And especially in a pandemic, they may not be achievable. So we have to really have realistic expectations, timelines, and our goals, and make sure that we manage that appropriately. If you do find that you end up going to a therapist, so after you've spoken with your confidant, you might end up needing to actually seeing a healthcare provider and getting therapy. And right now, I didn't talk about the specific therapies because it's individualized, depends on what you want to do. But there's talk therapy, there's a whole bunch of therapy, music therapy, etc., as well as medications that can help if you end up having a medical diagnosis of anxiety disorder. All right, last topic, depression. So depression is a persistent feeling of sadness, lack of energy, loss of interest in your activities, physical symptoms, eating, sleeping, all those things, right? And again, if it happens 1 day, 2 day, it's probably okay. It's when it becomes persistent, constant, where it interrupts with your daily life, then it becomes an issue, at which point you should seek out a professional help with a healthcare provider and help them figure out what's going on, because they want to be sure, again, that you don't have something medical. It's not diabetes. It's not because your blood sugar is off the wall or because your blood sugar is too low. It's not because your thyroid is off the wall because it's too high or it's too low. There's some medical conditions they have to basically rule out to make sure that's not the problem. So you would eventually need to see a healthcare provider for them to figure that out. Symptoms of sadness that you typically know: feeling sad, blue, feeling down, sleeping too much or too little, gaining weight, which a lot of us probably will. I did certainly in the pandemic, because you're eating all this comfort food and I wasn't exercising. So I've gained a couple of weight like we all have probably. And then just a constant bombardment with what's going on globally. You may have problems concentrating, loss of interest in your usual activities. If that's just happening over the short term, this is a normal response to change. The problem then is if it becomes constant, persist for 2 weeks, 3 weeks, 6 weeks, then it's problematic. But before all of that happens, before you've kind of gone down that path, that rabbit hole, I encourage everyone to really speak to someone you trust, someone who can give you an objective information, and to seek out help early. That's really what you want to do, seek and help early. You're not alone. Help is available. There are multiple things that you can do. Talk therapy, equine. Well, you can't do equine therapy now because you probably can't go to the horse farm. But multiple modalities available to you, medications, etc. It's individualized, so I didn't specifically get into drugs or the type of therapy here. Only for us to recognize that it's depression anxiety, you're not alone. Many persons are affected. What we really have to do as a community is to recognize it early and be sure that we have the resources available and let folks know where they can go to get help. This is a map that's showing that basically COVID is all over the place. What can we do? Remember, you're not alone. Help is available. This health series is meant to kind of highlight that, to remind you you're not by yourself. Help is available. Reach out to us. Reach out to the West Indian Social Club, the West Indian Foundation. You have a lot of people who have a lot of information available. Don't do this by yourself, and you shouldn't have to do this by yourself. Help is available, and it's just a matter of speaking to someone you trust and going to the community-based organizations that you know exist and getting the help that's needed. Another virus, hands, because you're not by yourself. The other slides were just to remind us about COVID-19, how to get testing. There are many mobile sites available. Won't focus on this. We can talk about that in the very end. The community events, I know last week there was one at might have been at the West Indian Social Club. But many persons are having the testing done. Get tested, document it. You can go every week if you want to make sure you don't get COVID. CVS, the clinic, CHS, Charter Oak, they all have COVID tests available. Most of the time you have to make an appointment, so make sure you do that. And finally, my one big thing is push is the vaccine is available. There's lots of information available. Jump on a webinar, jump on a call to find out what the vaccines are, talking about the side effects and the effects that are out there, making sure that you're informed about it. And of course, we will come back and have a webinar, a lecture series on the vaccine and tell you what to expect and answer your questions about any concerns you might have about the safety and the quality of the vaccine. And I think with that, again, just kind of pointing out the numbers you need to remember really are 911 and 211 for whatever you're looking for. If it's specifically on behavioral health, again, 211 is the place to call. You can also call 311. Of course, you know your zip code when you're calling. Last slide, key takeaways. Whether it's about isolation, stress, any other mental health condition, any physical health condition, whenever you catch something early, when you nip it in the bud early, you're better off than waiting it to that can kind of rolls down the street and you're kind of trying to pull everything back in. Not that you can't pull it back in at the very end, it just requires a lot more work and a lot more resources to pull you back in. So I'd recommend to everyone, do that early, ask for help early. We're giving you this information so you'll recognize some of the symptoms early, whether it's stress, isolation, anxiety, depression, recognize it early, ask for help early. And even though you can't physically go to a place, if you do find that you need to contact and speak with someone, know that teletherapy is available, telemedicine is available, and telepsychiatry is available. And with that, I'm going to stop, and I'm going to stop sharing my slides. And I see that there are a couple of questions, I think.
I think Becky has her hand raised.
I do.
Okay.
Go ahead.
Yeah. My question is that vitamin D is known to alleviate depression if you have a low level. And I was wondering if Dr. Rhule, would you recommend that people, first of all, get a vitamin D level, especially during the winter period when there's no sun to make the D, and especially for dark-skinned people, because we tend to have a lower level of vitamin D because of the melanin, and does taking vitamin D alleviate some depression?
That's a great question. A couple of years ago when Dr. Oz talked about vitamin D, and he talked about vitamin D that a lot of African-American persons who are of Black persons have low vitamin D low vitamin D level. people were laughing him off the stage. And the truth is, you do need to get a vitamin D level for the reasons that you just mentioned. A lot of us have a low vitamin D level. And the thought that is that it may even be linked to our having diabetes, that's one. Vitamin D is needed for many other functions in our body. So you need vitamin D, that's two. It helps with your depression. And interestingly enough, if you read some of the recent articles about COVID-19, some of the supplements they're recommending that you should be taking are vitamin D and zinc and vitamin C.
Yes.
So you should get your vitamin D level. And of course, everything I tell you, you have to consult with your healthcare provider to be sure. So get your vitamin D level, but you should consider taking vitamin D. It's going to help with your depression. It's probably going to help with your diabetes, and it's probably going to help with your COVID-19 infection if you get one, or prevention, as well as your zinc and as well as your vitamin C.
Thank you. That's a message I've been trying to get out.
Great question. Thank you.
Thank you.
Thank you. I have some questions that were sent to me in the chat. With chronic stress and not having to deal with COVID-19 pandemic, you gave several examples of how to cope. But what do you say to people who are truly feeling hopeless?
So, yeah, I firmly believe that the way to get help is to really speak with a therapist, a talk therapist, right? And so a talk therapy or any kind of therapy, people feel that person is telling you what to do. No, what a therapist does is help you to, you basically talk about what's happening to you, what's going on in your life, and what that person is trained to do is to help you get a perspective of everything and help you think about what you've described, options that might help you cope and deal with your chronic stress. That's really what a therapist does. They don't solve the problems for you. They don't tell you what to do. They help you put a perspective, a different lens on everything that's happening in your life. And the analogy I would use is, folks say the best view of New York, the best view of New York City is from New Jersey, right? When you're outside of New York City, when you're on the New Jersey side and you look back, that's the best view of New York City. So if you're the person under chronic stress, for example, if I'm under chronic stress and I'm in New York, you're in it. You can't see it. You can't see. What you're seeing is really what's around you. You're seeing the trauma that you're experiencing. What the therapist helps you to do is they are going to take the view as if they're looking at everything happening to you. They're looking from the New Jersey side. And they can help you get a different perspective. I'm not even saying better, just a different perspective of what you're experiencing. And the way they help you is to help you think through some of the potential solutions to help you get out of that chronic stress. And and so I think that's what they do. And chronic stress, I brought out acute stress because I wanted to make the difference between if you have an acute stress that's not dealt with, eventually it's going to become chronic because we haven't given you the support system that you need to get out of that. And we can talk about it in many, many different ways, right? A lot of African-American, Afro-Caribbean, Jamaican persons are under chronic stress. I know people hate to say it because of systematic things that have forced us to live in certain places, force us in an education system that doesn't meet our needs, limits our jobs, our housing, our development, and a lot of that creates chronic stress, right? You may not change that in a day, you won't change it in a week, but the talk therapist helps you to look at some of the solutions that you can look at to get to the other side of whatever it is that you're facing, whether it's something like that, or whether it's intimate partner violence, or whether it's isolation. They help you to kind of figure out what some of those solutions could be.
Okay, thank
Yeah.
you. Here's another question. What suggestions do you have for parents with children that are not doing well with online learning and showing high anxiety, depression?
That's a great question too. So we have to realize that as parents, right, it's the same way. You're kind of in it, you're in the moment. You can do a couple of things initially. You communicate with your child every day, talking about what you know are stressors, any way that we would go through that are age appropriate. Whether it's a teenager, you know, bullying happens at school, you know, they get teased at school, the feeling of wanting to belong, you know, all those things happen. So to really having an open, as much as possible, conversation with them. You know, sometimes when they're teenagers, there's this peer pressure to experiment with drugs. If you don't openly ask, you're going to say, well, not my kid. No, we've all gone through that, right? So as much as possible, you try to create the open conversation with them. But there's also a point where a support system outside of yourself is helpful, whether it's your grandparents or a therapist on the outside who is trained to do those things, to use the support systems that are available. A lot of faith-based communities have people who are licensed clinical social workers, they're mental health workers, they're behavioral health specialists. This is what they do every day anyway. And there are a lot of them that would volunteer to provide that help to you or to provide that service. So I would answer it the same way. As a family, you do what you can do in your home, but it's like physicians heal themselves, right? You can't do all of that by yourself. So at some point, you should seek outside support and outside help from a trained professional. And I know there's a lot of stigma around that. We can talk about that, you know, you don't want your kid to be labeled, but you want your kid to be healthy and you want them to do well in school. And you should find someone that you trust, There are many, many therapists. So just because you go to one, you may not like their personality, you may not like the way they talk, whatever reason, you may not like the way that they look, but there should be somebody out there that you can relate to and you can have that conversation with for the benefit of your child.
Thank you. It's open for questions.
I might as well speak. I was wondering, since we have my sister and I, Melanie, we had a friend that committed suicide. He was an actor and I think somewhat of a sensitive person, very outgoing. He had a wife, he had family near him. He used to be in New York with us, but he was in Houston when it happened. I think he was white, but I think some of the things going on affecting Black people probably was a strain on him, because he had Black friends that he cared about. So my question is, what kind of a person, or if you could give some kind of a profile of a person to be the one that we should be calling? I mean, most of us have more friends than we could probably call. Who's the ones that we need to, besides being at home alone, that we need to check up on?
That's a great question. Okay, so suicide is not a diagnosis. Suicide is a condition. So people who have depression, schizophrenia, people who, right? So anxiety, depression, schizophrenia, a mental health diagnosis may commit suicide because of feelings of helplessness and a feeling of hopelessness. And so we believe, and I believe, that suicide is preventable because there are obviously a lot of resources available that sometimes we don't access early enough. So I'm going to answer your question about about what we should be doing. But just so that we know, there is a 24-hour suicide prevention hotline. right? It's 1-800-273-TALK. I think I got that right. So 1-800-273-TALK, that if you have any feelings of helplessness or of hopelessness, you would call and they would put you in touch with someone who can speak to you. There are a couple of organizations, the National Alliance on Mental Illness, Mental Health America, that has peer counselors that you can call and they will speak with you. People who commit suicide are feeling helpless and hopeless. And so knowing that, one, people should not feel that they're alone, and they should get the help earlier on and really seek out those help earlier on from persons who are trained to do that. And with that said, what can we do as concerned residents, friends, family? Really to keep engaged with people, to call them. The reason we're talking about isolation and stress is because we know some of this stuff puts people at risk. And what I don't want you to walk away from, though, is feeling that if you didn't call, you did something wrong. Because what a lot of persons who are going through depression and anxiety will do, they sometimes before they actually commit the act, they appear completely normal.
Yes.
Right. So it's kind of hard to tell what people are going through because sometimes they're not going to tell you what they're really going through. But always, so what I'd say is always keep the lines of communication open with your friends, your family, asking them about what's going on, how they're feeling. Hopefully they're truthful about what's happening, and just like you're doing now and we're doing on this call, to let people know about the resources available, that they're not by themselves, and they will actively seek that out. If you ever, so that's one part of the answer, just to keep that open line of communication going. But if you hear someone saying or hinting that they are thinking about that, that's a red flag. Ask them frankly, are you thinking of killing yourself? Before people would say, well, if you ask them, it means they're going to do it. No, that's not what it means. If you ask them, frankly, I heard, let me see if I hear you correctly. You're going through a lot, whatever you're going through, are you thinking of killing yourself? That's a red flag. And of course, in your thinking, you have to get them help. Typically, if you're in the same place, 911 is where you would call. Or to ask for professional help to figure out what to do at that point, but not to let it go unchallenged, unstated. You need to actually ask them directly. If your friend is far away, if you even call 911 and tell them the location, they can figure out how to get that person help. In Connecticut, in Hartford, there's a mobile crisis unit that can be activated through that system if you just have a concern about, you want them to go check on that person. Not that they've said they're gonna harm themselves, but a mobile crisis team can go to their home, they can do an elderly check to be sure that person is safe. And typically the response is with a licensed clinical social worker and a psychiatrist. They knock on their door, they talk to them, they kind of figure out what's going on, and then make an action plan with that person, either to then go to the hospital, or if they feel that they're not at risk, there are no guns in the home, there's nothing in the home that's going to harm them, they will interview them probably for the 30 minutes or the hour, and then make a plan is, can I come back and check on you tomorrow, or can I check on you in 3 hours? So they'll do that intervention. If that answers your question.
Not quite, because what I was looking for was a profile besides a person who has a diagnosis, because most of the time you're not going to know if your friend has a diagnosis. They're going to hide that. So especially if they're not that close a friend, they're like the second or third tier friend. So I was looking for a profile, maybe like artistic type, or outgoing people, or introverts, or what's the type of a person that we should be the first person we call?
Right. So, so certain people who you know are at risk. So we are really asking for the risk factors for persons who potentially may want to harm themselves. People who, as we talked about, people who are in isolation, right? They're by themselves. People that you know as a friend do not have a support system, whether that's family, friends, co-workers, your neighbors, you know that doesn't exist. They're really kind of maneuvering through all the trauma they have by themselves. Those are persons who are probably at risk. People who are obviously have a mental health condition. People who are using a substance, right? Because then what happens is that kind of builds upon impulsivity. If you're using alcohol, if you're using cocaine, if you're using PCP, any type of drug contributes to impulsivity. So those are some of the risk factors that you know are going to put somebody at risk. A youth is at risk, especially a teen that you know is isolated. And whatever way you may have found out about some of the trauma that they're going through, whether it's bullying, domestic violence, sexual abuse, physical abuse, anyone who has gone through that and you really know that because of the personal connection, you know that's a risk factor. Especially if they don't have a strong support system or someone they can go to for help. That's a risk factor.
Thank you.
You're welcome.
Thank you, Dr. Rhule, and thank everyone for the questions that were asked. We're a couple minutes over our allotted time, but I just wanted to thank everyone who's attended most of the sessions. It's really appreciated. The sessions will be recorded and will be on the West Indian Social Club website. This is our last session for the year. We will begin the second Monday in January, which we will begin with another health series. And at that time, I think we will be talking about the vaccination. So I appreciate everyone being here. Have a good holiday. Have a good holiday, and we will see you next year. And the question is there a way to see this again? It will be on the West Indian Social Club website. It'll probably go up one day next week. So thank you, everyone, and have a great holiday.
Thank you. Good night.
Thank you.
Good night.
Bye. Merry
Thanks.
Christmas. Happy holidays.
Thank
Too.
you.
Good night and thank you.
Good
Oh, you're
night.
welcome. Good night.
Thank you.
Great job, Gary. Good job.
Oh, you're welcome. Thank you. Thanks.